Hi parents, does your baby struggle to gain weight no matter what you try, no matter how many different changes you're making to your diet, to the formula, no matter how many different discussions with the pediatrician? Is your little one still struggling to gain weight, stick with the growth chart, and maybe they're stuck, maybe they're even falling back on that growth chart? And when that happens, the concern obviously goes through the roof for both professionals and for parents, because we can start to be moving down the road towards a diagnosis of what's called failure to thrive. Now, those words are pretty heavy words because it's a serious situation that absolutely, first and foremost, needs to be checked out medically. 1 in 5 kiddos of failure to thrive has some underlying metabolic medical condition that needs to be taken care of in that incredible world. But if it's 1 out of 5, 20%, that means 80% of failure to thrive infants have no known identifiable medical cause to their struggles with weight gain, absorption, and getting on track developmentally. And so for most families with a failure to thrive infant, this video is going to be wildly informative, wildly helpful, because it's going to give you those answers, and it's going to get into the root cause of what's really going on with their digestive system, what's really going on with their metabolic and their neurodevelopmental system. And what we'll do is we'll take this tough condition, we'll take this tough conversation, and we'll get really nerdy and really intricate, but we'll really get into a simple understanding of what's going on. We'll talk about the perfect storm path that many failure to thrive infants were on during pregnancy, labor, and delivery, that they end up in this stressed out, struggling to gain weight state. And then most importantly, we'll get into the answers and the action steps you can take that are drug-free, that are natural and safe for your child to get their digestive system, to get their absorption, to get their nervous system and their weight gain back on track. We have been blessed in our clinic for the last 16 years to help tons of little ones struggling with not just some of the almost kind of pre-failure to thrive stuff of colic and constipation and difficulty nursing, but when you take all that together and the child is really struggling and you end up with this failure to thrive diagnosis, we've been blessed to sit knee to knee with many families and dig in and partner up and get their kiddos to the other side of this struggle. One of them, who still every week we get to see this kiddo as a wellness kiddo, Tucker. And Tucker is just this beautiful, incredible, well-dressed young man who loves coming into PWC. But at first, Tucker really struggled, and he ended up with his failure to thrive diagnosis because his sensory perception, and this is a simple way to say it, but it's absolutely what was going on. He was such a picky eater as a little one that they literally couldn't get any food with good substance, good nourishment, good proteins, and good fats into his system. And also, the reason that he was such a picky eater and he had such sensory and dietary aversions is because he was so stressed and his nervous system was so out of whack that when those foods did get into his system, it caused significant disruption and dysregulation. So what happens, and this is a very important part of failure to thrive, is the brain and the nervous system learns. And so for our little ones, their digestive system is still immature and has a lot of development to do. And their nervous system, which controls digestive motility, absorption, elimination, and function, it's also really immature and has a lot of development yet to do. All of that to say this: it means it's really sensitive, even when it's working well, even when it's working normally for a child who is in that first year, 2, 3 years of life. And so what happens during these sensitive, critical periods of development is our children, when they get stuck in this what's called sympathetic fight or flight perfect storm, they get stuck there fast, and they can get really far down the road in getting stuck in this sympathetic storm. And that was Tucker. He had the most limited profile of foods of perhaps any patient we had ever seen at our practice, until he got into the solutions and the actions we're going to share with this video, until we got his nervous system to relax and shift back into rest, relaxation, and most importantly with failure to thrive, this word, digestion mode. And so let's break down the science of how this really works and what is really creating these challenges that add up to failure to thrive. Well, number one, before we look at gut function, so whenever a child is struggling with these sort of things, and it very much is absorption, nourishment, nutrition, A lot of times, because our current medical system is so siloed and it's so segmented and everybody has their unique specialty, everybody looks in one little window and one little part of the body instead of looking at the part of the body that controls every other system. And that is the central and autonomic nervous system. The first thing that the nervous system controls in a developing infant is the muscles that latch, swallow, chew, and bring food into the system. And then this autonomic nervous system, it's called the autonomic nervous system because all of this is supposed to happen on autopilot. It's really just programmed awesomely into the neurology of our babies that they can find mom, find that, to breastfeed, bottle feed. It's really kind of, in this conversation, and we're going to make it the same, the neuromechanics, if you will, of swallowing, latching, eating. Well, then once that food, once that nourishment gets into the digestive system, there's something called the vagus nerve, VAGUS, and it rides along into the esophagus, into the digestive system, into the stomach, into the small intestine. And there's this neurological, autonomic, automatic control that moves food through the digestive tract. And it's not just moving it along to get it out of there, where it will eventually end up, in the diaper. But in that process, it is supposed to do two very important things that are completely under the control of autonomic nervous system regulation. Number one, we're supposed to absorb the good foods. So we're supposed to absorb the nutrients. And there's actually neurological programming and signaling from the brain to the digestive system through the vagus nerve and these sensory nerves that controls what that is. So move number one, absorption. Move number two is then assimilation. Now that's a nerd word for organization. So getting the proteins, getting the fats, getting the macronutrients, getting the micronutrients, getting the minerals, getting everything into the baby's physiological system, and then sending it where it needs to go to create growth and weight gain. So what we really have to figure out with things like colic and failure to thrive is not just why their gut is shut down from a gastrointestinal, probiotic, digestive enzymes, nutritional standpoint, but really we need to investigate what's called neurogenic gastrointestinal issues. Now, neurogenic is a simple, nerdy word for saying the original stress is generated in the central and autonomic nervous system. And if that is thrown off track, especially if the nervous system is shifted and stuck into what's called sympathetic fight or flight nervous system, the very first thing the body does is it preserves and conserves energy. Because the fight or flight response thinks that something big or bad is going to happen. So it actually shuts down digestive, motility, absorption, and assimilation. And it readies the body for this protective response. So there's a saying by this famous cellular biologist, Dr. Bruce Lipton, that says you can't be in growth, which is what we need to turn back on for our failure to thrive, failure to grow kiddos. So you can't be in growth and protection at the same time. So what we find every single time in our failure to thrive infants like Tucker is that their nervous system, their sensory stress system is stuck on. They are shifted into this sympathetic fight or flight dysregulation. Now, the last thing I want to teach you with this video is, well, what would cause that? What would trigger that? And it's really, really simple. It's what we call the perfect storm. The first trigger of this sympathetic fight or flight nervous system dysregulation in infants is a high stress pregnancy. In the literature, it's called maternal distress or maternal inflammation. And in today's world, a lot of times moms are under a significant amount of stress. And unfortunately, medically, we don't support them. We don't empower them. We don't encourage them. The traditional medical approach to pregnancy is to diagnose a woman as pregnant and scare the heck out of her all the way through. Now, that's a whole nother conversation for another time, but it's something we're very passionate about, supporting and empowering and coming alongside moms and celebrating their pregnancy and addressing stress on their nervous system ahead of time, because we know that's not only good for them, but that actually gets us ahead of this sympathetic fight or flight inflammatory storm that the research and clinical experience now shows us that if there was a high stress, high anxiety, high tension pregnancy, if there was digestive challenges, if there was thyroid challenges for mom, Well, then these metabolic, digestive, neurogenic challenges for baby can show up later on in life as well. And the second trigger within this quick little three-part perfect storm is birth trauma, birth interventions like forceps and vacuum and emergency C-section, where we use either tools or a big set of hands to yank or to grab hold of, yank and twist a child by their head and neck out of, and a lot of times these interventions are life-saving for mom and baby, but they're also life-altering for their vagus nerve, their autonomic and central nervous system. And the first place that birth intervention is going to show up in an infant's life, because the nerves that control swallowing, latching, and tongue and jaw function are coming from the upper neck. So they're going to have difficulty, just like Tucker, with the actual neurobiomechanical action of latching, swallowing, chewing, and getting food into the system. So there might just be a literal neuromechanical obstruction from what's called subluxation, from birth interventions at the very beginning of birth. So that needs to get fixed first. And then second, that same area, when injured in birth trauma, gets in the way of the vagus nerve, because the vagus nerve actually leaves and branches and goes down through the neck into the thorax, and it activates digestive motility, absorption, and assimilation. So what happens with a high stress pregnancy birth intervention is we're sending kiddos' nervous systems into this fight or flight sympathetic response by shutting down their vagus nerve. And the first thing that gets shut down is that digestive absorption, assimilation, and growth function. And the third challenge is when the nervous system is shut down and the gut is messed up, it's in a much more pro-inflammatory state. So yes, then we put dairy, then we put grains, then we put toxins into a child's already stressed and susceptible system, and we're going to have this inflammatory cascade. But generally, the inflammatory component of digestive distress in infants comes as third trigger, not first trigger. So what we've been talking about all along is the fact that the real underpinnings of failure to thrive is a central and autonomic nervous system that is stuck in sympathetic fight or flight overdrive. Once it gets shifted into sympathetic fight or flight overdrive, that's the same thing as saying the parasympathetic rest, regulation, digestion, growth, and development side of the nervous system is shut down. So if you've heard about the gut-brain connection, it is absolutely real, it is absolutely true, and it is done by the vagus nerve and the autonomic nervous system. And that vagus nerve is so sensitive to emotional stress during developmental and prenatal periods, and it's so sensitive to physical stress from birth trauma and injuries to the neck from forceps and vacuum and emergency C-section and breech position and cord wrapped. And it is also very sensitive to inflammation and toxins and those things as well. So what that all adds up, and what I want to show you just visually, is a case like Tucker's. We can actually measure and quantify this neurological, neurogenic, sympathetic dominance, and overall what we would call exhaustion. Because what happens with failure to thrive is after that little one's nervous system fights so hard and gets so stressed for so long, it eventually just runs out of gas and it becomes exhausted. So what we're looking at here is an HRV, a heart rate variability, which is just a global autonomic vagus nerve stress test. And we're looking at it for one of our little turkeys who was failure to thrive. And all you need to see with this is that white dot right here, really low on this chart. So this green here, green is good. Green is resilient. Green is adaptable. Green is where the nervous system and the digestive system would be able to control motility, control and have optimal absorption and assimilation and growth generated. But what we see here is on this autonomic activity index, when a child's nervous system gets stressed out real early, real often, it gets really exhausted. And so a low functioning HRV is a sign of low vagus nerve parasympathetic responsiveness. So that side of the nervous system just can't do its job. And I just wanted to not only talk about this the whole time, but even show that HRV, because here's the deal. I bet you are trying your awesome brand new parent butt off to get that good nutrition in. You're trying to supplement, you're trying to maybe fortify things, right? To get your child to gain weight and get back on track. But even if you're putting all the right stuff in, it can't get in, get assimilated, get absorbed, get assimilated, and get used if your child's nervous system is sympathetic dominant and neurologically exhausted. So the final thing I'd encourage you to do with this, I know, super nerdy, but also we kept it super simple and straightforward video, is you need help. This is the job of a neurologically focused pediatric chiropractor. We are the only ones out there in healthcare who understand this perfect storm pathway of how those early and often stressors can take the child's central and autonomic nervous system at a total foundational level and shift it into sympathetic dominance, which then shuts down the gut and everything we've been talking about in this video. But here's the most important thing. It's one thing to know about it. It's one thing to find it, like these HRV and another scan we use in our office called the thermal scan. You've got to get those scans for your kiddo. You need more information on this because it's one thing to find it. It's a whole nother thing to fix it. And so the last thing I want to share in this video is when I say fix it, I don't mean that chiropractic, this nervous system focused pediatric chiropractors, we don't look to cure colic, failure to thrive, chronic ear infections. There is no cure. There is no diagnosis in the way we work. That's the business of medicine, not chiropractic. What we do is we address the real root cause. We don't cure, we take care of the root cause and we address it head on. The coolest thing about the techniques, the safe, gentle, you're going to watch your baby get adjusted and you're going to go, that's it? That's all it is? Because a wound up, stressed out, stuck in fight or flight, not gaining weight little one needs the safest, gentlest, easiest adjustments to put their nervous system back into parasympathetic. We know exactly how to stimulate and activate the vagus nerve and the parasympathetic system. It's a very special set of training, experience, and techniques that not all chiropractors at all know how to do. And that's okay, because other chiropractors are trained more in traditional neck pain, back pain, that sort of stuff. But the doctors at our practice and the doctors in the pxdocs network, we not only know this science and these clinical protocols and use this technology, but we're trained in the exact right, safe, gentle, effective techniques to shift your child into parasympathetic function, which is growth, digestion, regulation, absorption, assimilation, and development. And when you activate that parasympathetic vagus nerve system, you finally get to shut down that sympathetic fight or flight, stuck on overdrive nervous system that we've been talking about all the time. And probiotics don't quite get in there. Digestive enzymes don't quite get in there. Formula changes don't quite get in there and access the nervous system like a neurologically focused pediatric chiropractor at our practice, PwC Chiropractic, or within the pxdocs network can do. So what I want you to do is send us a DM or comment below if you feel you need more resources, more education, more explanation of how this works. But if you are ready to get your little one off this failure to thrive, stuck, stressful point and back into growth and development neurologically, then go to the directory. We'll add all the links to this video, put your zip code, put your city in there, reach out, get connected, get scheduled. You can literally do it right through the directory. Get scheduled with one of our PX doctors to do a deep dive consultation, get into the scan and examination, and most importantly, get your child these neurologically focused parasympathetic vagus nerve activating adjustments to turn that growth mode back on and get them back on track, weight gain, developmentally, neurologically. If you found this video helpful and you know another family who's struggling with this or something like it, please also share and send that along. Thank you very much. We'll see you on the next one.